Welcome everyone. This is the purple month. That's why we are now in the month of awareness of epilepsy. We know that epilepsy is one of the greatest curse in the human, but the thing is that this epilepsy can be easily controlled by many available medicines, and if we follow some precautions, so epilepsy will not harm the life of a man who is suffering from that. Now, as you know, all our body is related with nervous system. In brain there are lot of electrical activity which is regularly going on. Once this electrical activity suddenly excess, then this produces transmission of waves inside the brain, and by that there are manifestation in the body like that of convulsion, like that of abnormal sensation in the body, like that of autonomic symptoms, that means erection of the hairs, and also palpitation, sweating, and some sort of behavioral disturbance, and many times there is loss of consciousness. So a person who is suffering from sudden onset episodic disturbance of loss of awareness, abnormal movement, abnormal sensation, or abnormal autonomic activity, so these are the persons who should be strongly suspected is suffering from epilepsy. Now, this epilepsy can be diagnosed by taking history, and the most important part while the patient going to the doctor is that he should accompany some witness. When doctor asks some questions about the features during loss of consciousness, only witness can tell that, because those persons who suffer from epileptic fit, they are unaware about their motor manifestation or sensory manifestation. So one witness must be there, and meticulous history taking will lead to diagnosis. But sometimes it is necessary to take the help of electroencephalograph, and sometimes CT scan of brain is necessary, and nowadays some patient can be diagnosed with the help of MRI brain. Once epilepsy is diagnosed, now doctor try to counsel about the patient about what is the things and what should necessary step patient should take. And pharmaceutical treatment is a major treatment of epilepsy management, and if you have to take the drugs, you have to take the drugs regularly, and patient should follow the doctors whatever he is saying, and there must be something which patient should do or which patient should not do during this epileptic fit. Now, if we think of the attack itself, if anyone sees the epileptic patients having fit, usually fearness comes to everyone because of the abnormal posture, abnormal loss of consciousness. So do not be panic. Do not go very close to the epileptic patient except one or two persons who want to help him, and try to help the patient to lie one side, so that frothing which comes outside the mouth, they can go outside, and do not restrain patient, and try to avoid any sort of injury. So that any sharp instrument which is situated near the patient, it should be removed, and patient should be in himself. Do not restrain him, and it will happen that 3 to 5 minutes, usually seizure stops. So then you have to go to the doctors and to take the help of further taking the drugs which can prevent this type of attack. Now, during frothing, what you can do, you can take some handkerchief or that type of thing and fold it, and you can insert it inside the teeth, in between two upper and lower teeth, and what you can help the patient to tighten the garments and help to make the oxygen, that means the should not be overcrowded, so that area patient can get lot of oxygens. Now, the important part of epilepsy management is that you have to stick to medications, and if you should not take various type of substance or addiction, like that of alcohol, patient should not take cigarette or any sort of smoking agent should be avoided. Any sort of abnormal lifestyle, so reduced sleep, not taking food properly, excessive activity, excessive sleep, excessive food, all this abnormality can increase the incidence of seizure. Obviously, the medication should be taken very regularly and meticulously, and whatever seizure, if 1 or 2 seizures occurs, and they should contact the doctors, and again doctor will adjust the dose or change the dose. Now, many times it happens that patient, they take the help or suggestion from other members of the family, other members of the society, and sometimes it has been said by those non-medical persons that epilepsy is not curable. So that's why they do not, after taking drugs for sometimes, they sometimes omit a drug and go on to taking some alternative medications, although alternative medications have not proof that it can, no proof that it can control seizure. So that should be avoided because it is treatable conditions, and so you have to follow the advice of the doctors and advice of the medications. It is not a disease which is caused by some demon. It is not a disease which is not curable. It is not a disease that it can be treated by other sort of medications except this what we scientific medicines, allopathic medicines which brings. And the thing is that whatever this type of episode occurs, do not ignore it. Even I have seen that educated person, they concealed their son or their daughter is suffering from fit, they conceal themselves, and they think that once they are recognized as epileptic, the school teacher will shun him, the other friend will avoid him, but it is a great offense, as epilepsy is not a contagious disease. It cannot spread to other person, and one from epileptic person, if sharing food from one epileptic patient will not spread epilepsy to other person. So don't think in that way. So epileptic patient is like that of other patient, like that of diabetes, hypertension, hypothyroidism, or so on. So treat those patient as a human being. They are not extraterrestrial things. So this awareness is very much necessary, and epilepsy is very common in India, possibly because of infection in the perinatal age group, possibly due to still home delivery is going on in many of the various villages. So these child suffer from hypoxic ischemic brain damage. They also suffer from meningitis, encephalitis at their tender age. And unfortunately, the modernization, it increases the vehicles, number of vehicles, motorcycle, scooter, cycle, and various type of vehicles, particularly two-wheelers, they produce a lot of head injury, and that head injury is one of the major cause of epilepsy in our country now. And as the age is, gradually we are living more. So as we become elder, so we have dementia, we have vascular stroke, we have brain tumor. So again, these age group are also suffering from epilepsy or seizure disorders. So everyone from child to elderly person can suffer from this. Take it like that of disease like the hypertension, like the diabetes, and treat these patients. Do not shun away or do not avoid these type of patients. So this is the message what I can give you in this purple day, purple month of this year. Thanking you. Thank you for coming here or become a audience, audio-visual member of this purple month. I am Dr. Ramesh Bhattachariya. I am Associate Professor, Department of Neurology, Calcutta National Medical College and Hospital. I have also some practice, and I am seeing many patients of epilepsy. So I think I can have some experience about this epileptic patient. And in this purple month, I want to talk to you about epilepsy, its prevalence, its do's and don'ts, its treatment, and something awareness which needed in these days. Thank you.